Mariam Abdallah Ali lost her daughter in May after the toddler swallowed an object found on the floor.
But when we went to the local health center, they told us they could not perform an operation on her because they didn't have the right equipment. They said we had to go to the city of Samara for the operation, but my daughter died on the way.
Ali lives in the town of Bahale in Ethiopia's Afar region, where Tigrayan forces who occupied the region until April destroyed healthcare facilities before they left. The regional government says 60 health centres were put out of commission by the occupying forces, although Tigrayan forces and the Tigray regional leadership deny allegations. A doctor at the centre where Ali took her daughter said they no longer had the equipment to save her.
This health centre was one of those where medical devices were available. In the past, we used to perform operations because all the equipment and the medications we needed were here. But the TPLF destroyed this health centre completely.
The Tigray People's Liberation Front, or the TPLF, did not respond to VOA's request for comment on the damage in the region. In nearby Kanaba district, a health centre was ransacked and severely damaged.
The
medical laboratories have been completely destroyed, and we cannot carry out health checks because we do not have medical equipment, even treatments for AIDS and diabetes. There is a big shortage of medications. Also, the lack of electricity has a negative impact.
A similar story at this hospital, funded by a German non-profit. While the need for food aid in Ethiopia has been dominating the headlines, officials say there is a great need for medical services too. The UN's World Health Organization says that just 22% of healthcare facilities are fully functioning in Afar and the neighbouring Amhara region, compared to the period before the conflict began in late 2020. It's not clear how many medical facilities remain in each region. The World Health Organization says there is a life-threatening shortage of medical services in Afar towns, once occupied by Tigrayan forces. The WHO told VOA medical aid and food aid must be combined to be effective in Ethiopia.
Whether it's in terms of essential supplies, whether in terms of monitoring for infectious diseases, whether it is in terms of immunization services or services for mothers and children. It's really important for these services to be provided at the same time as food.
For Ali, aid came too late to save her daughter, but for others, there may still be time. Henry Wilkins for VOA News, Bahale, Ethiopia.